And now, Ralston reports.
Welcome back to Ralston Reports. A cultural shift in America is making the legalization of marijuana almost a certainty. Now the New York Times is advocating for allowing states to make the decision to legalize. Not everyone, even medical marijuana advocates, thinks that's a good idea. Dr. Michael Levy is an addiction specialist in Las Vegas who says the new weed may be too powerful for the new smokers. Welcome to the program, sir. Thanks for coming on.
Thank you.
So let's talk about what I asked all of our Facebook users and others and Twitter followers to answer. Is this going to create an explosion of new users? Will it remain the same? What will happen?
I don't know the answer to that yet. More likely it will increase the number of users initially. And I'm concerned about that.
You're concerned why?
I'm concerned because we don't know the impact of that on society. We don't know the impact on driving under the influence of marijuana. Although the studies that have been done in other countries clearly state that the individual is impaired under the influence of marijuana and their judgment in terms of driving is significantly impaired.
But that could be true of medical marijuana, right? If you prescribe medical marijuana to somebody, you're going to say you shouldn't drive too?
Absolutely.
Yeah.
No question about that.
Do you think doctors will say that when they prescribe medical marijuana?
I hope so.
But do you think they are?
I don't know that because I'm not a prescriber of medical marijuana, but I am for it as an initial stage for the development of cannabinoid-based medications.
You know, I read a paper that you wrote. It's very interesting. You mentioned these cannabinoid medications, and everyone's looking at their TV now saying, what the heck is this guy talking about? But you talk, I mean, people think of THC as the active ingredient. But you write about how you can extract certain other substances from it that can have an effect on the brain, and that's really what triggers addiction and other kinds of problems, right?
That's true. Very much so.
So talk about some of these. I mean, people know about THC. What else is in cannabis that can help people?
Well, there are actually over 65 identified cannabinoid substances. THC is certainly one of those substances. But we haven't had the ability to research them. All of the research that's taking place is happening outside of the United States. And some of it is rather profound. The new studies that hopefully will start to take place because of Sanjay Gupta's CNN special, and that was profound for me as well when I saw that little girl stop having seizures.
That was a very pro-medical marijuana documentary that CNN did called Weed with Sanjay Gupta.
That is correct. Actually, there were two of those. And people are leaving states, quitting jobs to go to Colorado now to be able to obtain that particular substance, Charlotte's Web, that is helping children stop having seizures. If the DEA and the federal government can continue to object and say there are no medical uses for marijuana, clearly that is wrong.
You know, it seems to me the best argument, Doctor, for this, I'm going to get in a moment to what the New York Times was arguing for legalization, but is one part is what you just named. You have a kid, and your kid is suffering in any way, and you can try something new. Nothing's worked, and so you want to help them. Also, end of life, right? People are often in pain, want relief from that pain. Why wouldn't you want to allow old people who are about to die or close to death to use something like that? You know, older folks and children, that seems like the two best arguments. Am I wrong?
Well, those are significant arguments. The Nevada law identifies 8 particular conditions under chronic and debilitating conditions. However, there are other conditions that doctors will identify and which potentially will be impacted by the use of medical marijuana. But again, I want to emphasize that this is strictly a first step in terms of the development of these medications. And I'm hopeful that it will happen relatively soon because smoking this drug certainly offers negative impact as well.
You know, I saw you did an interview with my colleague Dana Gentry on Vegas Inc., and she asked you what you treat people for the most, and I think it was painkillers and heroin and then alcohol. Do you not treat people very often for addiction to marijuana?
I've been practicing addiction medicine for over 30 years, and in those 30 years, there have probably been 10 people or less that truly met the clinical criteria for marijuana addiction.
So why would you be so concerned then? Because a lot of people think that medical marijuana is just a bridge in many states and maybe across this country to recreational marijuana. If it's not on your radar screen, 10 cases in 30-plus years of practicing, what are you worried about?
Well, I'm worried about the fact that those 10 cases were based on perhaps a different marijuana. Today's marijuana is much, much stronger. We have no idea of the THC content, although with the medical marijuana testing, we will know what the THC content is. THC is the active psychological component and the addictive component. So if we can start to do the research and identify other compounds within the marijuana plant that potentially have medical usages, where's the negative?
Let me show you something from drugpolicy.org, where the Drug Policy Alliance says that marijuana potency is not related to the risk of dependence or health impacts. Get your take on this. When access is regulated and controlled, like in medical marijuana states, we see a wider variety of potencies, including marijuana with virtually no traces of psychoactive THC, but high in cannabidiol, CBD, which is highly therapeutic but not psychoactive. In any case, potency is not related to risks of dependence or health impacts. THC is virtually non-toxic to healthy cells or organs and is incapable of causing a fatal overdose. What do you think of that?
Well, I don't disagree with that, but the fact is that the numbers support what I'm saying, that 9% at least of people who are using marijuana will become addicted to it. And that concerns me.
Well, 9% is a very high number, right?
Absolutely.
And so do you think that the people will just not be able to regulate themselves? I mean, what is the analogy between alcohol and marijuana in your mind?
Well, most of us are social users of alcohol, and we leave it at that. But again, there are a specific segment of users that will become dependent on them. And we find that over and over again, not only with alcohol, with other substances. We regularly prescribe narcotic pain medication on for appropriate reasons, but at the same time, there is a significant number who will become physiologically dependent, and some of those will also become psychologically dependent. It goes with the territory. We can't necessarily legislate our way out of it, but we can do research that hopefully will provide different answers.
Do you think you're ever going to get a definitive answer on some of the questions that you're asking? Because at some point, the political momentum for this may overtake whatever the research that's been done, right?
Well, I think that's true, and I just want to be a voice of reason that supports the medicalization of this drug and supports the fact that it is a first step towards development of other medications that potentially offer benefit to this society.
There hasn't been a lot of research done in this country, right, on some of these other cannabinoids besides THC, right? There's very limited, and so we don't know much about them. We may find out that they have other curative or palliative purposes we don't even know about, right?
Absolutely correct.
All right, we're going to take a break. A lot more to talk about with Dr. Levy. He's an addiction specialist. Marijuana legalization is coming. If the New York Times has anything to say about it, stick around.
And now, Ralston Reports.
Welcome back across Nevada to Ralston Reports. This weekend, the New York Times, the paper of record, said it's time to repeal prohibition of pot. What does it mean? Should we go from medical marijuana immediately to recreational here in Nevada? It might happen. We're privileged tonight to have an addiction specialist in this town, been practicing for more than 30 years. Dr. Michael Levy is with us. In the paper that you wrote, I was very interested in one phrase that you used. You said that Nevada has the opportunity of, quote, doing it right. What does that mean?
Well, in terms of all of the regulations that are coming down from the state, from the county, from the city, I want it to be not over-regulated, but appropriately regulated. And I want the dispensary owners to really appreciate the fact that we're dealing with a medicine here, and that the people that will be using this medicine should be considered as patients. Not as hippie hippies from the past with long hair and wearing a marijuana leaf T-shirt.
But I mean, doctor, the fact is that what's going on in this state, medical marijuana was approved here almost a decade and a half ago, overwhelmingly by the public here, as you all know. You have gaming authorities, I think, who have a double standard on this. You have your own medical board has a double standard on this because marijuana is still a Schedule I drug. How do you navigate that? How do you do it right?
Well, in terms of doing it right from the federal level, it's my understanding that just this week a bill was introduced that will change the federal schedule from a Schedule I, meaning that it has no medical usage whatsoever, and lower it to a more appropriate schedule, Schedule III, Schedule IV.
Do you know how Congress works, sir? Do you think this is going to actually happen?
I hope so.
Okay, well, so you think it shouldn't be a Schedule I drug anymore?
No, I don't.
You don't?
I don't think that it should ever have been a Schedule I drug.
What should the medical board in this state be doing, telling doctors who want to prescribe medical marijuana, who want to talk to their patients about medical marijuana? What is the right instruction they should be giving?
Well, I think the problem with the law right now is that doctors aren't necessarily involved. They write a prescription for medical marijuana and you give that to the patient. The patient goes to a dispensary, does not see any medical provider there, does not receive any medical information necessarily. I want the doctors to become much more involved, much more educated before they write that prescription for medical marijuana.
But I didn't even think that they were writing those prescriptions here in Nevada. And if that instruction is supposed to be given to doctors, what better place than from the state medical board, which is the place that should be a repository of research, should be the place that should be giving guidance to guys like you and others. Am I wrong about that?
No, you're not wrong, but there are the political realities, as you know, and I'm just one doctor trying to make a difference.
Are you trying to be a diplomat, too, in how you're talking about the state medical board?
No question about it.
You're doing a fine job
Thank you.
of that. Let me show something else from the essay, an essay that you wrote about marijuana. Here's what you wrote about the dangers of the drug. While death due to toxicity of delta-9 THC, that's the primary psychoactive component of cannabis, has not been observed, fatal painkiller overdoses quintupled nationally from '99 to 2008. More people now die from narcotic analgesic overdose than from heroin and cocaine combined. What does that tell us?
Well, that tells us that we have a number of people who are using prescription painkillers in particular that maybe are taking much more than they should, maybe are taking it without direction of the physician, maybe are buying it off the street where it's readily available and dying from these substances. And that clearly concerns me. It is the #1 drug that I detox people from and treat.
Don't doctors, aren't they writing prescriptions for this themselves and giving them to patients and making money off of it? They're dispensing it, are they not?
Well, I wouldn't say they're dispensing it. Writing a prescription is not dispensing it. There are doctors that dispense from their own office, but most people go to a pharmacy, as they're supposed to, but some of them go to multiple pharmacies and see multiple doctors. And unless the doctor is savvy to a certain extent, he or she may miss it entirely. And it's unfortunate because, again, these are life-threatening problems that may be easily eradicated.
Do you think it's possible, you mentioned this number in the previous segment, that you've seen maybe 10 patients in over 30 years, more than 30 years, addicted to marijuana. Do you think that you missed a lot of them? In other words, do you think there are a lot of people addicted to marijuana already out there who just don't go in and see a Dr. Michael Levy or never end up in front of you?
That may be possible, certainly.
But do you think it's likely is what I'm asking you?
No, I don't think it's likely. I think the patients that come to me because they want to get help and they don't know where else to go. My practice is totally committed to the evaluation and treatment of addictive disease, and so the patients that come in clearly want a different perspective. They want to be treated. They want to get off their substance, but most of them, for the most part, are very honest in terms of helping me help them.
It seems to me the biggest problem, and we're out of time, is that you know a lot about what addiction to pills and alcohol looks like. We don't know yet a lot about what addiction to marijuana might look like, and that's the problem going forward. Dr. Levy, it's been a pleasure having you on the program. Thanks for coming.
Thank you so much, Sean.
All right.
Privilege.
When we come back, we're going to get your reaction to this question on our Facebook question of the day. Stick around.